Kia ora koutou katoa, everyone. I am aware that we have come down slightly early, so I'll just hold for just a moment until everyone's ready to go, and then give you a few introductory comments before handing over to Dr. Bloomfield. Good evening. Cabinet has met this evening to make decisions on our response to 3 cases reported earlier today within a household in Auckland. Shortly, I will ask Dr. Bloomfield to set out some further information we now have relating to these cases. But first, I did want to make some brief remarks. New Zealanders have enjoyed more freedoms for longer periods of time than nearly any other country in the world, and we have never taken for granted how special that was. But with COVID raging outside our borders and new, more transmissible strains of COVID-19 emerging, we've had to make both continual improvements to strengthen our border while continuing to plan and prepare for managing any potential resurgence in the most effective way possible. Cabinet's plan is based on the best science and what we know works from previous cases here and responses we've observed overseas. Before I share with you decisions that have been made earlier this evening, I'll pass to Dr. Bloomfield, who'll provide an update on the cases. Then I'll set out those decisions and outline what it will mean for New Zealand.
Thank you, Prime Minister. Kia ora koutou katoa. So just to update you on the details around the COVID community cases that we talked about earlier today. To recap, there are 3 positive cases, a mother, father and daughter from one household in South Auckland. There is one other household member who has symptoms but has tested negative. This person will, however, remain under investigation as a close contact. The 3 members of the family group who are positive cases have now been transferred to the Auckland quarantine facility. The 4th member of the family who tested negative remains at home under strict isolation and public health supervision. Genomic sequencing is underway for the first 2 cases, and we will have the results through later this evening from ESR. An update on our locations of interest. As we've said earlier today, one of the largest locations affected is the Papatoetoe High School, where this daughter is a student. There are around 1,400 students at the school, and it will be closed Monday and Tuesdays. The daughter's immediate classmates are being treated as close contacts, as are a small number of teachers who taught that class. If anyone is one of those close contacts, the instructions are to please self-isolate at home and call Healthline to arrange a test and to get further advice. All other students, teachers and members of the school's community should also stay home. Call Healthline to arrange a test and stay at home until they return a negative result. A pop-up testing centre will be at Papatoetoe High School from tomorrow morning, and that centre has been set up specifically for students, parents, caregivers and staff. It is important we are able to prioritise testing for these groups, so please ask other members of the public to not attend the testing at that high school, but to use one of the other testing facilities in the community. Again, just to reiterate, I understand that people will be concerned. However, I do want to assure people in South Auckland that we are taking this approach out of an abundance of caution. Just an update on LGS Sky Chefs, which is the workplace of the mother. As we said earlier today, the mother in this group works there and she is involved in handling laundry from international flights. I can confirm that she's not involved in handling of food at that employer. As we continue to explore all possible sources of transmission for these cases, we will take a particularly close interest in this workplace because of its obvious connections to the border. However, it is too soon to rule in or out any particular source of transmission through that workplace. The father is the most recent one to test positive. He is self-employed in the building industry, is currently asymptomatic, but has now tested positive. there is an extensive list of locations of interest now for all 3 of these positive cases, which is on the Ministry of website, and we will continue to update this. I should say, just looking through that website, that it includes a number of places in New Plymouth that are tourist attractions or eating places, as well as outdoor places. The outdoor places like the Egmont National Park or others, those who were there at the times on the website are considered casual contacts, and all they need to do is just be aware of symptoms and be tested. People be tested if they develop symptoms, having called Healthline first. People who were in the indoor places of interest are asked to isolate and be tested and remain isolated until they get that result back. Now, I should say that there will be people from outside New Plymouth who may have visited and been at those locations at the same time. So it's important for anyone who's been in New Plymouth over the last week, or certainly over Waitangi weekend, to check the website and see if they are included in that time that the cases were there. There are also 1 or 2 locations that are en route to New Plymouth, including the McDonald's in Drury at the BP Motorway Service Centre. So again, if you have visited that place on the 6th of February, then please do look at the website. The relevant time there is between 7 and 8:15 a.m. on Saturday, the 6th of February. So, in terms of Taranaki, there is testing available there, as we have indicated, and that has been happening this afternoon. Finally, just to close with a message now speaking to the rest of New Zealand, as well as the people of South Auckland. It's more important than ever that everyone right around the country continues to play their part and remains vigilant. If you wonder what this means for you, what you might do, whether it will make a difference, yes, indeed it does. So, please, if you feel unwell, call Healthline and arrange to get a test. Keep up the hard work with hand hygiene, cough and sneeze etiquette that we continue to reinforce. And please, keep up with using the NZ COVID Tracer app. Turn on Bluetooth and scan wherever you go. There's been a huge amount of work around these cases already over the last 24 hours, and there will be people in the public health response and elsewhere working into the night. We are going hard and early around these cases with our public health response, as we have previously, but the health system cannot do it alone. As always, it's the together that will make a difference. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. As you will have heard from Dr. Bloomfield, these new cases pose questions our public health staff are working around the clock to answer. We don't yet have a complete picture of the potential source of the infection and spread, if any, beyond one household, and we are waiting for the genome sequencing and serology, both of which will provide important pieces of this puzzle. Regardless, Cabinet has chosen to respond with a cautious approach that has served us so well previously, and with the working assumption, just in case, it could be one of the more transmissible strains of COVID that we need to act with a high degree of caution around. The most important lessons we've learned from the times that we have stamped out flare-ups successfully before, and from cases we've seen overseas where outbreaks have gotten away, is the need to go hard and early. Avoid the risk of a wider outbreak and therefore the risk of having longer periods of restrictions. In line with this precautionary approach that has served us so well as a country to date, Cabinet have made the following decisions. As of 11:59 p.m. tonight, Sunday, February 14, Auckland will move to level 3 for a period of 3 days until midnight on Wednesday. The rest of New Zealand will move to level 2 for the same period of time. This will be reviewed on a 24-hour basis, and we will provide daily updates, the first of which will be tomorrow afternoon. And I can assure you that those 24-hour review periods are for us to indeed consider if there's any information that leads us to believe we can safely move down levels as well. 3 days, though, should give us enough time to gather further information, undertake large-scale testing, and establish if there has been wider community transmission. That is what we believe the cautious approach requires and is the right thing to do. Let me set out what that means for Aucklanders and the rest of New Zealand. A quick reminder of those alert levels, which we haven't experienced for some time. The levels remain as they were the last time we moved to level 3 in August for Auckland. That means the main thing we are asking people in Auckland to do is to stay home to avoid any risk of spread. That means staying in your bubble other than for essential personal movement. People should work from home unless that is not possible. If you go outside your home, please maintain physical distancing of 2 metres outside, or if you're in a controlled environment where you know others present, 1 metre. We're asking children to stay home from school, but you will remember that in level 3, schools at years 1 to 10 and early childhood education centres can open for children whose parents need to be at work. You'll remember that supermarkets, pharmacies, primary produce retailers and petrol stations, they will all remain open throughout. So once again, no need after this announcement to rush out to get any essential items. All of those providers, supermarkets, pharmacies, they will all be open and continue to be open. So no need for a rush. But we are again asking all other businesses that usually interact face-to-face with customers to move to those non-contact methods, you remember. That means click and collect or ordering online. The main rule here is maintaining physical distancing between staff and not physically interacting with customers. So those are our goals at level 3. Public venues, you'll remember, do close. For example, libraries, museums, cinemas, food courts, gyms, pools, playgrounds and markets. Gatherings outside of your bubble are prohibited, with the exception of groups of 10 for wedding services, funerals and tangihanga. Physical distancing and public health measures legally must be maintained at those events if they do occur. And again, I would just encourage people, if you can, postponement would be the wisest thing to do at this point. Healthcare services will revert to usual virtual non-contact consultations where possible. Now, interregional travel, so travel in and around Auckland, for example, it will be highly limited. But, for example, people can go home if they're in Auckland and that is not their place of residence, and vice versa. Mask wearing on planes, trains, buses, ferries and in taxis will be required. Of course, Aucklanders are well used to that now. A border will be put in place in Auckland. The border will be broadly similar to last time Auckland was at level 3, but important improvements have been made based on that experience. Those who need to travel through the border can go to the MB website. You'll remember we had an exemption regime, but if you can avoid that travel, please do so. People at high risk of severe illness, such as older people and those with existing medical conditions, are encouraged to stay at home where possible and take additional precautions when you're leaving home. If you're in Auckland, we ask that you use a face covering if you need to leave your home. That brings me then to what level 2 means for the rest of New Zealand. Just a reminder. This will also come into place, the level 2 settings for those outside of Auckland, the rest of the country, from midnight tonight, and we'll run through again till midnight on Wednesday. Businesses and schools remain open, but with public health guidance, including physical distancing, record keeping, and of course we continue to encourage people to take up alternative ways of working if you can. There is, of course, at level 2 throughout the country, compulsory mask wearing on public transport. And again, you're encouraged to wear masks where you cannot physically distance from others. Mass gatherings will be limited at level 2 to 100 people. Hospitality businesses must keep groups of customers separated, seated and served by a single person with a maximum of 100 people at a time. Finally, we have stamped out the virus before and we will do it again. We have a plan that works for our team of 5 million and you have shown that time and time again. Before I finish though, some quick health plans that we have put in place. Auckland Health officials will be expanding the testing capacity across the Auckland region. They will seek to test thousands of people over the coming days in order to understand any potential cases beyond those that we have already detected. It's our intention, as Dr. Bloomfield has said, to test students, staff and members of the school community from Papatoetoe High School. We'll be testing workers at the affected work site. We'll also be undertaking wide testing of those who are symptomatic, particularly in Auckland. We ask anyone who's experiencing cold or flu symptoms to get tested. If you are well, and if you have not visited any of our sites of interest, please, there is no need for you to go to a testing station. And I ask that with sincerity. We want to make sure that those who are at our testing stations are those we need to prioritise. And if you are well and not at a site of interest, you potentially clog up that process. Testing centre hours across Auckland have been extended in response to our current situation. They have already reported strong demand, but you will be able to find all of your available locations on the Auckland Regional Public Health Service website and on HealthPoint at covid19.govt.nz. Finally, I'm asking New Zealanders to continue to be strong and be kind. I know we all feel the same way when this happens. We all get that sense of not again. But remember, we have been here before. That means we know how to get out of this again, and that is together. If you know someone in Auckland, reach out, please check on them. And if you're in Auckland, please check on your neighbours, ensure they're looked after and supported. And finally, as I've said all the way through this, ultimately, please remember, we are going to be okay. Happy to take questions.
Was the decision made not to move to level 3
For the rest of the country.
Plymouth in particular,
Yes.
given all of those locations of interest there?
You'll remember we've had a situation like this before where ultimately the household really that was in question, primarily resident and working in Auckland, despite having travelled at that time to other parts of the country, public health advice at that point was that the risk, given that those contacts there were casual contacts, was lower. Obviously, we've also had return tests from people they were travelling with that have returned negative tests. So that's the advice we've been given, but I'll give Dr Bloomfield the floor as well.
Thanks, Prime Minister. Yes, that was certainly our advice, and the Prime Minister's picked up on some very important information I forgot to impart, which was the further interviews had identified the mother and daughter who travelled to Taranaki did so with 2 other people who are close contacts. They are in isolation and have already tested negative. We got those results just before we came down. They will remain in isolation for the full 14-day period. There were also 2 other close contacts, family members who visited the family home last Wednesday. Again, as close contacts, they will remain in isolation for 14 days, but their initial tests have also returned negative.
The decisions that Cabinet has made tonight, was it responsible to allow those large events like Big Gay Out to go ahead today?
Well, of course, keeping in mind that we've made this decision in quite rapid turnaround and done so with the ability to get our orders in place so that we can actually mandate what we're asking the New Zealand public to do. But look, we've acted as quickly as we can. I'm confident that we've made the decisions that we need to make at the right time. The ability to shut down some of those events successfully and safely is not always straightforward either.
Flare-ups.
Yeah, Jessica.
What is it about this case these cases that are making you nervous and tipping you into those restrictions?
That's not how I would describe the decision. I would describe it as cautious, and rightly so. And the reason for that is some of the more recent cases we've had very clear links to, for instance, MIQ facilities, our isolation facilities, and a very clear sense that there's likely to have been human-to-human transmission. That's the most likely way that people become infected with COVID-19, is people-to-people. Here, we do have someone that we have tested as part of our testing regime out of caution, but they're less likely to have human-to-human contact with people who might have COVID. It's more what we call fomite transfers, so dealing with the laundry of people who might have COVID. So that in itself suggests to us, let's be cautious. It may be a variant. That may mean it's more infectious. So those are some of the reasons. And also because we have not quite yet put a ring around this particular set of cases.
If I can just add to that, I think the 2 things that were critical in my advice were, as the PM has said, that it's not entirely clear where this person's infection came from right at the start. And whilst the most likely explanation it is through the mother's workplace, because of the onset of symptoms with the mother and the daughter being about the same time, we want to rule out that it wasn't the daughter who was infected first, potentially in the community. And that's why, and likewise, with these more transmissible variants becoming more common now in all the travellers we're seeing from overseas, from wherever they are coming, it's absolutely appropriate, and you can see Australia doing this, is taking a very precautionary approach to these sorts of infections.
You'll see that we weigh them all up based on exactly what we have in front of us. So recently, cases where we had a clear picture. This one, a few more questions. Our viewers, you'll have less regret if you move early and hard than you will if you leave it and it gets out of control.
Is this an example, though, of how vulnerable our border workers are at the front line without having the vaccines, and we're still 6 days away from even starting that process?
I think it's an example of how tricky COVID-19 has always been. It has always been a tricky virus. You know, some might argue that over time, because of the way a virus behaves, that gets worse, not better. And so, yes, of course, we want to protect those who work at the front line. And this is an example of why we need to, but it won't change the level of caution that we need even once they're vaccinated.
Bloomfield, what kind of...
Joe, and then I'll come to you, Jason.
Just further on that, Dr. Bloomfield, are you sort of constantly surprised, I guess, by how this virus is evolving like this? You look at the Northland case, the husband didn't get infected despite being in the car. You've now got people who have travelled to New Plymouth. They don't seem to be infected. Does this make it really difficult for you when there's no sort of clear patterns there?
Well, what it emphasises is the need to be very cautious with this virus, because you can't predict exactly who will infect someone else. And we have seen these interesting situations lately. At the same time, as we've seen these infections in MIQ facilities, as have a number of places in Australia, that didn't seem to happen in the first 10 months of our running of managed isolation, that may be something to do with the new variants. I should also say that there is a lot of variation between people in terms of whether they will infect any other person, or indeed how many people they will infect. Yeah. So whilst we talk about an R value of 2 or 3, that doesn't mean every person infects 2 or 3 others. Most people infect no one else, but there are some people who infect a lot of other people. That pulls the average R value up.
Some people who visited some of these places that are considered I think it's the casual plus category, isn't it, might sort of go, well, why would I need to be tested when people are in the same car for hours with these people haven't even tested positive?
And to that I would say what we've seen in our managed isolation facilities, and also have seen, again, Australia have seen this as well, is sometimes the infection can transmit from one person to another, even if they are not in the same place at the same time. So I would strongly encourage all those people, for their protection and for their protection of the community, to do so.
Give yourself the confidence. You don't want to exist with a constant nag in the back of your mind of whether or not you might make your friends and family around you sick because you didn't get a test when we asked you to. So just give yourself that confidence. Jason.
Just on the person that was doing the laundry, was that the person wearing appropriate PPE gear when she was dealing with the laundry?
I would need to refer to
I would
Dr.
assume
Bloomfield on this.
so. I think in these workplaces they would be wearing protective equipment anyway, regardless of whether there was COVID-19. And yes, this is an employer that is on a regular cycle of surveillance testing as well.
Yeah.
I'll
come in here and then back to you.
On that surveillance testing, should this worker not have been tested on February 1st?
So they were on a rotation, as I understand, and this is a rotation. These are managed by employers, but that particular person was meant to be tested alongside their colleagues every 2 weeks. Our understanding is that they were tested on the 18th of January. That would have meant that they would be retested on the 1st. They were on annual leave during that period, and so the next time they were tested was at the time they were symptomatic. The one thing I would say is that even then it's not guaranteed that test necessarily would have demonstrated that they had COVID at that point. However, that is not to say that those regimes should be maintained, and that's something that we will be entering into discussions with employers around, making sure that if an employee misses a test, they should be tested.
Different employer though, she was on leave from February the 5th, did you not say, Dr. Bloomfield?
I believe she was on annual leave at that time as well, so on 2 different occasions.
Did she go on annual leave?
Not continuously, obviously back in the workplace in order for them to be at work on the 5th.
So you're saying that if you're away on annual leave, there's no pre-departure testing?
I'm not saying that at all. My expectation would be that there would be a way that we were ensuring that regardless of whether you were at work or not, you maintain a regular testing cycle. That is up to employers to make sure that is happening. We'll be making sure we're having conversation with employers to ensure that is happening. Keep in mind, this was someone on a 2-week rota rather than our MIQ workers who are more regular. And this is still not the way to assure ourselves consistently that someone does not have COVID-19. Someone could be tested on the 5th, pick it up on the 7th, and still wait a week till they're tested again. So we do tell people they have to keep an eye out for their symptoms as well.
Expectation was that they should have been tested before they went on annual leave, and that didn't happen.
My expectation generally is that people keep up their regular rotation of testing. That's my expectation.
Can you not make it more
During the
regular?
last community cases, you expressed surprise that Australia would close its one-way travel corridor to New Zealand. I'm guessing you expect them to close it.
Oh, entirely their decision. Yes, I maintain the position I did on the Northland case. Obviously here, we've moved our restrictions and I'm sure they'll base their own judgments on the information we've shared with them. And we have been sharing information with them across the course of the day.
Can I also ask, I mean, with the disclosure that the McDonald's on February the 6th at 7 a.m, at that exact time at the Waitangi Treaty Grounds, you were serving breakfast to thousands of people without any sort of social societal restrictions whatsoever. Does it give you pause for thought as to whether potentially we've been too lenient here over the journey?
No, because at that time the public health assessment was there was no need to. Of course.
Right.
Oh yeah, and of course we have a system that allows us to pick up as quickly as we can and react as quickly as we can. But what you're proposing is that we constantly live at a level 2 environment when there's not a public health reason to do so. The whole reason for our alert level system is as soon as we see issues, we respond immediately. And that's what we've done on every occurrence to date. Just canvas around.
On the new variants, how concerning would it be if this person wasn't infected with one of the more transmissible variants? You know, how different and how much, I guess, scarier are they compared to the virus we used to deal with?
Well, we're working under the assumption that it is one of the new variants. And the reason for that is we've just seen an increasing proportion of the whole genome sequencing on our cases in managed isolation, regardless of where they've come from. They don't need to have come from the UK or South Africa. Regardless of where people have come from, these are the common variants now around the world, and we do know they are more transmissible, possibly because of a higher viral load. So that has informed my advice and the response at this point in time, and it's not. I think it's no scarier in the sense that we have acted accordingly.
And keep in mind, even with the emergence of the new variants, we've responded at the border with pre-departure testing, day 0 testing in our isolation facilities, no movements till a negative test has been returned, and we ask people to stay in their rooms once they've had their final pre-departure test. So that has been in response to some of what we've been seeing with these new variants as well.
Make any decisions
Yeah, Richard.
around economic...
In the Cabinet debate that you've just had, or the Cabinet meeting that you've just had, what were the factors that you weighed up both for and against? Because presumably you had some cons.
Yeah, exactly the same as we always have. So the way we conduct the meeting is to start with the latest information from Dr. Bloomfield and his recommendation. Very quickly, for all of us, we turn to the practicalities. Our view is that the precautionary approach has served us very well to date. And now, given the current global environment we are in, that further reinforces, not weakens, the need for that precautionary approach. New Zealanders will also see we don't hesitate to rely on our contact tracing and our public health system if we believe that is justified. We did that recently, but in this case, the circumstances are different, so we've reacted differently.
Any decision like this carries inevitably a massive
It does.
cost.
We don't take that lightly either. And we actually, over the course of the day, we weigh up all of those things when we're having those discussions. But we're also conscious of the far greater cost to the entire economy if we make the wrong call in those critical first 24 and 48 hours.
Prime Minister, could I also add that, of course, I haven't developed my advice in isolation. I've been in a number of discussions today that have included my Chief Science Advisor, the Prime Minister's Chief Science Advisor, but also the National Response Leadership Team, which is convened by the Chief Executive of DPMC, convened in the middle of the day. That includes the Secretary of the Treasury and other CEs, and we go right around all these issues. I test my thinking with them and also take their advice and views on board in finalising my advice to Cabinet.
How much more transmissible these new variants are? Will you be looking then at increasing the frequency of testing of staff who may not necessarily come face to face with COVID?
Yeah, so keep in mind, of course, we have not yet determined that that's what we're dealing with, but we've made assumptions based on that. We learn from everything, so, yet to determine whether or not that's the source. But the reason that person would have been on a 2-weekly testing regime, Dr. Bloomfield, would have been because the advice would have been that they were low risk. They're dealing with only surface, and of course the evidence still suggests that is far less likely than human to human.
Correct.
But again, we learn every time, so if there is anything to suggest that that is the source, then of course we always review our settings, always.
What's your advice to MPs and ministers scattered around the rest of the country?
Yeah.
Are they supposed to come back to Wellington?
Yep.
Or what's the deal?
So same as before, and unfortunately we have been here before. So for level 2, people who are outside of Auckland, they are of course able to travel to Wellington. For those who are in Auckland, it actually ultimately comes up to the discretion of the leaders of those parties, because parliamentarians have on previous occasions still travelled to Wellington under those circumstances. I can share with you as Labour leader, I've advised my Auckland-based members to stay where they are.
Any discussions about economic support for businesses that will have to close in Auckland?
You'll remember that after a period of 72 hours, that's when we look to put in place economic supports again. So, look, that'll be something that we will be talking to directly as we move through and we get a sense of whether or not we will be staying or lifting out of those restrictions.
Will the lockdown slow the vaccine program?
I see no reason why it would. Every movement around the vaccine program we see as essential. Dr. Bloomfield?
Yes, so the team continues the planning apace, and we've got the team that's working on the vaccine, including the Deputy Chief Executive that's responsible for both the response and the vaccine. We split our work today, so I've focused on the response and she's focused on continuing the work on the vaccine. So,
will it produce like any late changes in prioritisations of who should get the vaccine?
well, at this point, the scenario that we are planning for is one of no or low community transmission. So at this point, we'd continue, and I guess this reinforces the importance of us vaccinating our border workforce as soon as
And
we can.
reinforcing why all those who are on surveillance testing are amongst those who would be first. Yeah.
Just confirm
Thomas,
that
and then I'll come to Jason.
No economic support for any businesses for the next 72 hours, but a lot of hope that it may lift.
If it's
sooner.
longer than 72 hours, of course, we move at that point. And that's what we established at the last occasion that we moved into level 3.
Are you hopeful that the saluting period will be shorter than 72 hours?
I am always hopeful that we can do get ourselves through this safely with as little impact as possible, which is why I flagged we will take seriously those 24-hour reviews. We will not stay there any longer than we believe we need to. And so the first one will be at post-Cabinet tomorrow, so 4 p.m. tomorrow is when we will be making our first announcements, plus sharing any additional information that's pertinent.
And on LSG Sky Chef, I mean, will you be expressing concern that they have not made sure a worker has a routine test while on annual leave? And will you be confirming that they are in fact using PPE in that setting?
Of course, we'll follow both those things too up. I should say that one of the tools we've made available to all employers whose workforces are being tested as part of the surveillance program is a border workforce testing information system. Many of employers have taken up that information system and process. Some haven't, and this is one. So we will be talking to them and I guess other employers. It's to assist them in their responsibilities to look after the health and safety of their employees. So we will just see if perhaps the use of that information system may assist them with making sure that they are reliably testing all their employees.
One thing again, I will just reiterate that it's not actually clear that even had they had that test on the 1st of February, that it would necessarily have picked up this case, which is why it is so important that as this person did, as soon as they experienced symptoms, they were tested.
Could have provided you with some extra reassurance though in making today's decision though, correct?
And how so?
If they tested negative, on February
Well, I mean, what we know is the period in which they were symptomatic would have been a 10-day period. So from the point that they may have been tested to the point they were symptomatic. So a little bit less likely. But again, as I say, very important that anyone that has symptoms, even if they're in a regular testing regime, we still ask them to be tested outside of that regime.
What does today's decision mean for the Prada Cup racing on Wednesday?
A very good question. We've been having this discussion. They have made the decision already to postpone Wednesday's racing. They, of course, already had Thursday as a postponement day. They haven't confirmed when the next race will be. I imagine they'll be doing exactly what the rest of New Zealand is doing and keeping an eye out on the new information that comes to hand. Audrey?
Yeah, if you're reviewing it tomorrow, I mean, is there any chance that it could actually be lifted tomorrow night, or the earliest it could be lifted would be Tuesday night?
A couple of the things that we'll be looking for, just to give you a sense of the things that we'll want to work our way through. Really getting through the testing at the high school. So I really ask people again, students, staff members, community members there who have that contact at the school, to make sure they come to that site and get tested. Testing of those, those contacts, finishing off the close contacts around the household cases, the work site, and the information from the genome sequencing. So we should get a early-ish picture, but we may not have all of it in that first 24 hours.
Realistically, the earliest it could probably be lifted would be Tuesday night, not tomorrow.
We'd have to build a picture very, very quickly for it to be by 4 p.m. tomorrow, realistically. And I think people can see that by what we need to get through.
I appreciate it's been
I'll come just over here again, and then I'll come back over to you, Jenna.
If you identify further spread in New Plymouth, would that make a case for expanding a level 3 down to Taranaki, or would it be a sort of nationwide alert level change?
I imagine that the advice we get is always based on the individual circumstances. You'll remember in August we did have cases outside of Auckland, but we were pretty clear that they were very easily, that they were contained and identified how they came to be in contact. So we'll always assess what a case tells us before we make those decisions.
Yes.
Yeah, Joe and then Jenna.
Have you had any indication of how good scanning has been in a lot of these places? I think it's probably a bit early to tell that, but presumably that would go a long way to ensuring people can get tested sooner rather than later.
What I can say is that the cases, the ones who travelled down to Taranaki, weren't using the scanning function, the QR code scanning on their apps, but that they did have Bluetooth turned on for most of the time, so that will identify some people who notifications will be sent to. But now that we do know those locations, we can send a notification out to anyone who did scan into those locations with the QR code at those times, and so they should expect a notification.
A good timely reminder too for everyone, please turn on the Bluetooth function and keep scanning. The Bluetooth function is not a substitute. It doesn't tell us precisely your venues, it just tells us those you were nearby. We still need those venue lists, so please keep scanning and turn on Bluetooth.
Do you keep a check on that? I mean, have you had any indication, I guess, over the last week or so, I don't know how regularly you check, as to whether things have dropped off or whether people...
We do. It is part of the reporting that we observe is what people are doing. We saw off the back of the Northland situation things lift again, but
yes.
New Zealanders can be a little complacent quickly, unfortunately.
Yes, so the scanning lifted after Northland. It's dropped back slightly, but it's stayed at a higher level. I would hope that this is a point in time when right around the country people
just keep it up.
Keep doing it.
Gina, then I'm going to finish with Audrey. Audrey.
Oh, do you know whether police are going to set up those roadblocks like they did last time, which appeared to actually create incredible queues on the motorway, southern and northern motorways?
So yes, they will. My understanding is that's most likely expected to be in place from the morning. In the first 24 hours, when those checks are undertaken, I understand it's very difficult to get documentation ready or evidence to demonstrate why you need to move. And so you won't need to have that within the first 24 hours to be able to move through. But after that, of course, we put back in place the usual checks that we ask of everyone moving through the border. And the one other thing, just really worth reminding, those who are affected know they were affected last time. They'll remember that we did add people to exemption lists. So it was the border at level 3 as it was when we finished level 3 last time, that will be back in place. So people will know if they managed to get those exemptions last time.
Quickly follow up on that. How quickly will you be able to get that info up on MB website so there's no confusion like there was last time?
I'll need to perhaps get that information out separately to all of you, but I understand that the MB portal is still the place where people need to go. But as I say, not requiring people to have that documentation in the first 24 hours I think will be really important. MB have also changed up their systems to make it more efficient than what people experienced last time.
So flights, just the Air New Zealand flights, I presume you've been working with Air New Zealand?
Yes, we have.
So people leaving Auckland should only be those who are returning to their homes in other parts of the country?
As it was last time, we understand people need to relocate. They may be in Auckland but not be intending, that's not their place of residence. So if you need to relocate either into Auckland or out of Auckland, you can, but we ask everyone else, please don't move around.
People can plan. When is Cabinet meeting tomorrow? And when will you make further announcements tomorrow?
So we're meeting at the usual time tomorrow, but post-Cabinet will be at 4 p.m. tomorrow. And that's when we'll give you updates and any further information that we may have to hand around our current settings. But as you can see, a lot of work to get through and a late night tonight as we work through some of that evidence. All right, everyone, I'll come back to you tomorrow.